So this is the osteon. These are the central canals. This is the lamellae. On the outside is the periosteum. And these are the Sharpie's fibers. On the inside is the endosteum. And these are the trabeculae. So this is the epiphysis. And this is the epiphyseal line. The medullary cavity. This is the compact bone. And this is the spongy bone. These are the trabeculae. And these are the nutrient canals.
So this bone is the clavicle right here. This is the sternal end of the clavicle. And this is the acromial end of the clavicle. Under the acromial end of the clavicle, you have the conoid tubercle. Right here, this is the scapula. This is the spine of the scapula. And attached to the spine on this end is the acromion. Right here is your glenoid cavity. And this right here is your cornoid process. Above the spine is the supraspinatus fossa, and under the spine of your scapula is the infraspinous fossa. On the inside part, you have the subscapular fossa, which is just this entire part under. So this bone right here, this is the humerus. This is the head of the humerus. This is the lesser tubercle, and this is the greater tubercle. So the lesser sits more on the front by the head right here, and the greater sits more on the outside of the bone, the lateral side. This groove that kind of pops out on the side right here, that is your deltoid tuberosity. Down here, you have your trochlea, your capitulum, which is this round part on the top of the trochlea, your cornoid fossa, and on the back side, you have your olecranon fossa. You identify the epicondyles by finding the head, because the head is always medial. So this would be your medial condyle, and this would be your lateral condyle. So the next bone would be the ulna. This little spot on the top of the ulna, this is the styloid process. This notch right here, this is your trochlear notch. This upper part right here, this is your cornoid process, and this back part is your olecranon. This spot right here that looks like it would fit the head of your radius, that is the radial notch, this part right here. You can tell that this is the olecranon, and this is the cornoid process, because this is the cornoid fossa and this is the olecranon fossa. So when you rotate the bone how it's supposed to be, the cornoid process goes into the cornoid fossa and the olecranon goes into the olecranon fossa. So the next bone right here is the radius. This is the head of the radius. Right under the head of the radius, you have the radial tuberosity, which is this little bump right here. And on the end, your wrist end right here, you have a styloid process. So the next series of bones we have here is the hand bones. So this right here is your thumb, or the pollex. Straight under the thumb, you would have your trapezium, then across to the trapezoid. Then this middle one is your capitate, and this one is your hamate, happy Thanksgiving. And then this right here, this little floating bone on the outside would be your pisiform. So the next bone we have here is your pelvis bone. This is only half of it. You would identify the front of this bone by finding the greater sciatic notch, which is on the back always, or on the posterior side. From there, your landmarks would go anterior superior iliac spine, anterior inferior iliac spine. This whole big part over the top is the iliac crest. The back part right here, you have the posterior superior iliac spine and the posterior inferior iliac spine. Under the posterior inferior iliac spine, you have the greater sciatic notch. And then after the greater sciatic notch, you would have the ischial spine, this little like ridge after the greater sciatic notch. Under the ischial spine, you would have the lesser sciatic notch, which is this little notch right here. And this like rough spot right here, that would be your ischial tuberosity. This big circle right here, this is the socket for your hip. It's also known as the acetabellum or acetabulum. And this large hole is the obturator foramen. Right on the edge of this is the pubis bone right here. Right in between where the other pelvis would attach, you would have the pubic symphysis. So our next bone is the femur. This hole right here at the top of the femur is the fovea capitis, which sits in the head of the femur, which is this large ball at the top. This part right here is the neck of the femur, the part that's under the head. This large, bony, landmark is the greater tubercle, and this smaller, bony protrusion is the lesser tubercle. This line down the back of the femur is the linea aspera, and the whole straight part right here is the shaft. This smooth part is your patellar surface, so this is where your patellar kneecap glides. And you can tell the lateral from medial condyle because the medial side is always on the side of the head. So this is the medial condyle and this is the lateral condyle. You would be able to tell the lateral from medial condyle because this is the medial malleolus. It's always on the same side. It's always medial on the tibia. So whatever condyle is on the side of the medial malleolus will be medial. So this is the medial condyle and this is the lateral condyle. This front ridge is the anterior crest. In between the two condyles, this little space right here, that is your intercondylar eminence. So it's between the condyles and it just means it's in between the condyles. And then this bony part right here on the front, this little bump, that is your tibial tuberosity. And then back down to the bottom, this is your medial malleolus. The next bone would be the fibula right here. So it would attach to the tibia like this right here. So this lower part down here, this would be your lateral malleolus, and this upper part will be the fibular head. So the big toe is your hallux, which is always medial. This right here is your medial cuneiform. This is your intermedial cuneiform. This is your lateral cuneiform, and this is your cuboid bone. This back part, which is your heel bone, is the calcaneus. And this bone on the other side of the cuboid, this is your navicular or your arch bone. This part right here, this bone in between the navicular and calcaneus, this right here is your talus. On the medial side, this big ligament right here, this is your MCL or medial collateral ligament. On the fibula side is your lateral collateral ligament. In between your femur and your tibia, you have your ACL, which is the anterior or more forward-facing ligament, your PCL, which is your back ligament of the inside of your knee. ACL is anterior cruciate ligament, PCL is posterior cruciate ligament. These little ligaments that sit in between the femur and the fibula right here, these are menisci or meniscus. Yeah, this would be your medial meniscus because it's on the side of your MCL, and this would be your lateral meniscus, which sits on the side of the LCL.
Interior view of the skull, you have supraorbital foramen, superior orbital fissure, optic canal, inferior orbital fissure, nasolacrimal foramen, infraorbital foramen, nasal cavity, alveolar process, and the mental foramen. So then you have the zygomatic arch, and then the external auditory canal. And then from the inferior view on the bottom, you have the incisive foramen, which is this little hole right here. These two right here are the concha, the mandibular fossa, which are these guys where this jelly is kind of blocking it, but this would be the area.
Styloid process.
And then the jugular foramen is this big hole right here. The carotid canal is this one right here. And then the foramen magnum is this big one right here. Then you have the occipital condyles on both sides. Then the hypoglossal canal is right here.
Yeah.
In the internal view for your foramens, you have foramen rotundum. So you have R, O, S. Your O is your foramen ovale. It kind of looks like an oval here on this side. And then your spinosum is the tinier hole just below the ovale. So that's your foramen spinosum. And then right here you have the foramen lastra. The internal auditory canal be right in here. And it's on this side as well. The greater wings, which are these ones. And then your lesser wings are going to be up here. Your Skeletal here. Clinoid processes, you have your anterior clinoid process and your posterior clinoid process. And the optic groove, cristagallar,
So this part right here,
which is the mohawk. Then you have your cribriform plate that it sits on. Jugular is here. The foramen magnum, coronoid process, condylar process. The head of the mandible is going to be on the inside here. The ramus is this area. The alveolar process is just below the teeth. The mental foramen is here, and the mandibular foramen is here. So for the sutures, you have the coronal, sagittal, lamboidal, and then squamosal.